one of my passions or my niche is radiation and radiation-induced soft tissue damage. Is there anything that you can think of off the top of your head with everything that you've done before? Because I've done fat transfers in patients who have radiated skin. It works okay, but it's not great.
How
Anything
much are
that you
you
have
putting?
suggest it depends on where, but a fair bit.
I think less is more, right? If you're able, and by the way, I do not harvest the fat and keep it because I'm terrified of like it getting contaminated and infection. So I do it on the spot, and that's why it's also nice to do it under local. But I think if you're doing it as a stepwise progression where you're introducing both microfat, but more importantly, I think in radiated skin, probably nanofat, while you're marrying that to like ablative devices, maybe fractionated CO2 even, I think it can restructure.
Welcome back to the DIEP End podcast. Today's guest is someone you've almost certainly seen, whether it's on your screen, in your social feed, or quoted across the biggest names in beauty, fashion, and health media. Today, we're joined by Dr. Shereene Idriss, a board-certified dermatologist based in New York City, internationally recognized for her expertise in skin health, aging, and aesthetic treatments. But what really sets Dr. Idriss apart is her ability to cut through the noise. In a world flooded with skincare trends, misinformation, and overpromises, she has become a trusted voice, educating millions with clarity, honesty, and refreshing dose of realism. In this episode, we dive into her journey from medicine to building a skincare empire, how she thinks about aging through a more holistic lens, and why more aggressive isn't always better when it comes to treatment. We talk about the myths that patients, even providers, still get wrong. We also explore where dermatology and plastic surgery intersect. This is a conversation about cutting through hype, thinking long-term, and helping patients look like the best version of themselves on their own timeline. So without further ado, let's get into it. Dr. Shereene Idriss. Welcome to another episode of the DIEP End podcast with Dr. Idriss. We are so excited to have her tonight for many reasons, which we'll dive into and talk about. I'm Saeed Azuri.
I'm Hank Davis.
And we have some mutual sort of family connections. And my sister came home one day and she was like, have you heard of this dermatologist up in New York? You know, she's wonderful. Family is like amazing, beautiful, very kind. And my sister was actually the one that recommended this because she knew of what we were doing here. So thanks again for joining us. And I think you'll offer such a unique perspective when talking about aesthetics, dermatology, aging, et cetera. So thanks again.
Well, thank you so much for having me. I'm honored. And thank you to your sister for connecting the dots and making this happen.
Yeah, I heard it was a fun party. I'm sad I wasn't there. So looking back, you know, I've had the opportunity to read a little bit about everything that you've done, your journey, et cetera. But how do you think that along the way, one of the things that I love to do and what Hank and I kind of like is to get the stories that aren't really told or you can read about. So what sort of drew you first off to medicine and then kind of shaped your path towards more of dermatology and aesthetics?
So, being Lebanese, right? Being an immigrant. It's like you got to be your own boss. But my parents did not push us into medicine at all. It was more
That's the opposite of me.
Really? Yeah, but it's like, it was more do something that, you could take with you if ever, a bomb falls over your head, you can run and you can go recreate a life somewhere else, which is really sad. But my family, it's genetically ingrained. I mean, I come from a family of doctors, right? So my grandfather was one of the first pediatricians in the Middle East, and my dad followed his footsteps. And when I remember very distinctly, I was probably 15 or 16, and I remember I had to do a summer job to pay back a phone bill. And it was at a desk job underneath these halogen lights. And I thought there's no way in hell I could ever do a desk job in my life. So I better get into medicine so I could save myself and then see what I'll do after I get my MD. And so that's literally how I decided to go into medicine. And once I really started thinking about it more so as a path, it started to make sense in terms of looking at dermatology because I really applied initially for plastics. So I got into the 7-year program and I was 16 years old when I was a senior year in high school. And I remember thinking, I love working with my hands. I never want to sit at a desk. I love creating things. I want to go become a plastic surgeon. But something quickly hit where I realized I also love people that talk back and that are not put out. And I want to grow with people and I want to get to know their stories and I want to evolve with them. And that's how dermatology came into play, where I could feel it was kind of that perfect intersection of I don't like convincing people they have a problem. So they see what they have. And there is an aesthetic component where people want to feel better in their skin. And that was huge for me. We can do a psychotherapy session later. But I think it was important because I was the fairest and the whitest and like the ugly white duckling of my family that I always felt I needed to kind of keep up in that sense. And it was a field in which I felt I could help people help themselves without changing the essence of who they were. And so I pivoted from plastics after I got into the 7-year program and started looking more seriously at dermatology, again, to kind of pursue it as a career and as a way of life where I can grow with my patients.
Yeah. I think, everything that you talked about like the overlap, and it's not uncommon that a lot of people have interest in both dermatology and plastic surgery. So a lot of that makes a lot of sense. But when you also, I think, sound like you have this like skincare nerdiness interest, where all of my friends who are dermatologists have like, they really are so passionate about skincare. And how do you think that the passion helped develop into a clinical and educational career?
It's, when you know how they say find your passion? I don't know if that's really true. I think it's also find what you're really good at and then focus on
Yeah.
that. So it's kind of the
Yeah.
flip side. And I love skincare and I obviously love skin and I love seeing people use it the right way. So it kind of went hand in hand. It wasn't ever like I sought out to pursue this path of teaching people on a larger platform. But as stars align, being curious about ingredients, being curious about trends, social media ramping up, me recognizing that patients were coming in, repeating information that wasn't accurate, getting cosmetic procedures that they never needed, not
Yes.
understanding what they got, not even knowing the treatment they had, not even understanding, the basics of moisturizing versus treating something with an active. There was this white space that, I felt dermatologists were not playing in. And I felt it would be, it's of utmost importance that we come into the space to also help educate from a clinical perspective what's going on. And also to learn, to see what people are actually thinking about and talking about, because we only see it one way, but once you're in the mix, you're hearing it from every direction. So I think it felt more like a responsibility rather than an opportunity. And so that's sort of how I landed on social. It was not pre-planned. It was not premeditated. There was no big dreams of becoming recognized or making money or starting a persona or even a brand. But that's how I landed in this world.
Isn't that so amazing to think back to it too? And how your path evolved. You even talked about, potentially wanting to do plastic surgery and then kind of coming into this dermatology world and then where you are now, and how life takes you on these paths and you just kind of go and you see where you go. But look at how far you've come along, which is so amazing.
I appreciate
Incredible.
that. I really appreciate that. I just think people oftentimes are so set in their path that they don't see where life could take them just by following what feels right. So that's why, again, follow what you're good at. And
Yeah.
then, things will open up, and hopefully you can, create something out of that.
Yeah. And then you have obviously this multicultural background, Lebanese descent, French educated, is that right?
Yeah.
And do you think that that's at all and we talked about it with me especially, like, I remember my mom as a kid, she had, like, her skincare to the T, and honestly, she's looks incredible. I feel like as time goes on, she looks better and better and better. Do you think that your multicultural background kind of influenced your career at all?
Absolutely. I
Yeah.
think it made me a better physician because growing up, so I went to a school that was, yes, a French school, but it was an international school. So there were
Which one
kids
was it
from
again?
the Lycée Français
Yeah.
in Washington, D.C. And I didn't realize it so much at the time, but being surrounded by different languages, different cultures, people from such different backgrounds starting at a very young age, it naturally teaches you how to connect with people beyond just words. And it gives you an understanding of that communication is really not about language. It's about emotion, intention, understanding like what motivates people, understanding cues that, you don't learn necessarily linguistically, especially when you're trying to like just across the board. And I don't think languages are my forte. I can speak every language, but everything I speak is always broken. And so
That's still pretty good.
I have to learn how to communicate in other gestures and stuff. But from a career perspective, that carried over and it allowed me to see people for who they are, to speak to them in a way that they feel seen, and hopefully vice versa. And it really is, I think, also reflected in the online community that I've built over the years, where it's an incredibly diverse international group of people who follow me on social throughout every platform. But that also then is reflected as well in my practice. Like I have patients who come literally from all walks of life, some who are saving every penny to come in, some who are overflowing in pennies, some who are coming from, you know, like down the road, and other ones who flew across 2 continents. So it's really interesting to see that reflection of social in real life in my practice, it all kind of ties back. And I think it goes back to that childhood, growing up in this setting where it was really, truly mixed.
Yeah. I was gonna say you were alluding to earlier how you want to combat misinformation when it comes to skincare and stuff like that, and you kind of take a scientific approach to this, obviously having a physician background. But there's a lot of skincare products out there that aren't backed by a physician or by science. What are some of the biggest myths about aging or about skincare that you're constantly trying to debunk or combat?
There's so many.
Yeah.
Okay, so I'm gonna give you guys a laundry list. You ready? So, okay,
Hold
I
on.
think
I have to write these down.
get your pen and paper. I think number one, like aging is just about wrinkles. No, it's not. It's definitely
Yeah.
not just about wrinkles. It's, you know, it's about changes in your pigmentation, your texture, your elasticity, your bone structure, your volume, and their wrinkles is
Content.
just
Yeah.
one piece of the bigger picture. I think another misconception is like skincare can do everything. They have view it as like this miracle bucket of like, it didn't really help my under eye bags, which is like a structural thing, or it didn't help, you know, pick up this skin that's starting to droop. And skincare is very, very intentional, and it can only do so much. And it can never really replace volume all over your face.
Yeah.
Also, like from a cosmetic perspective, I think there's others, so many. Aggressive treatments are automatically better, and you get better outcomes with more aggressive treatments. And I think in the social media era, when things are trying to be like a visual hook of something really intense, or you're trying to create like an intense before and after right away,
Yes.
it does not lead to the best long-term real world outcomes.
Yeah.
And the same goes in the opposite with like the whole fear-based, you know, algorithm of preventative aging with like preventative Botox, or this fear-based narrative that pushes people into trying things at a younger age to basically not age. And that's never going to happen either. So it's the
Yeah.
dimensional world of myths.
And it's very difficult, especially as you were saying, with the social media era, with filters and who knows what these before and afters are real. And we deal with the same, in plastic surgery, surgical before and afters. It's
Yes.
a problem, and especially with all those trends that you probably see on TikTok or on Instagram with the new pads or something stick on things, and you're probably like you're doing now shaking your head. But it's good that you're. That's why it's also. I know a lot of physicians previously like to shy away from social media, but I think it's important for us to be in that space, because then if we're not there to tell people that that's not correct, then who else will be there, to do that?
I mean, yeah, I mean, 1,000%. And if you're not there to tell people, then you're going to be wasting your time in your practice dealing with people coming in asking for the wrong thing, and you spending double the time trying to educate them. So I think one of the perks of having grown on social is I attract the people who are now into what I'm saying. So I don't necessarily have to convince them as much and rewire their thought process when they come into the practice. So
Yeah.
that saves a lot of time. But filters and social it's really shifted the perception of what normal is. And I think a big part of what I have to do, even in my practice though, even though patients are subscribed to my train of thought, is resetting expectations every single day, every single patient, making sure we're keeping it low. We're really focusing on identity rather than perfection. Like we're really trying to shift, our thought process, because it's hopefully a long-term game that we're playing and not like a one-hit wonder.
Yeah. I feel like we've heard that a lot before, Hank, as well. And I think many patients come to plastic surgeons later in life. And I think to myself about my mom, for whatever reason, I've retin A kind of embedded in my brain since I was a kid. And it's so funny because that's like the one thing that I've used since I was honestly as young as I can remember to this day. But how do you think people should start to think about skin health years before they even consider procedures like a facelift or eyelid surgery?
I think they need to start shifting their framework. Instead of viewing it as like a point in time, they have to see it as a continuum of time, right? And you see comments, by the way, of like older individuals who have beautiful skin, but they have laxity. And they go, what are you giving skincare advice for? Look at your face. But they're confusing matters. It's not laxity. She still has beautiful skin. And you really have to realize if you want to one day have a facelift, which By the way, I think it should be part of every discussion when patients come in for cosmetic procedures to understand where they're at mentally, emotionally, and physically. It's super important that people realize that behavioral factors, number one, play a huge role in the skin quality and healing. Before you even talk about skincare and the amount of money you're going to spend, focus on your lifestyle. Are we sleeping? Are we not smoking? Are we avoiding excessive alcohol? Are we trying to maintain or minimize sugar intake? I can't minimize it completely, but at least have it
I'm
on a
so bad
healthy
at that.
level. Same. So I'm not going to be a hypocrite, but you try to put things on your side, right? To minimize inflammation all over your body. We also focus on our routine. We try to keep a routine that we can be consistent with, because otherwise what's the point of having a routine? So focusing on your skin barrier health, is it minimal in inflammatory signs? Does it not have a lot of redness? Is it really, because does it have solid rebound, etc.? And when you put it all together, lifestyle, barrier health, inflammation, and also obviously genetics, those factors all in all come together to determine how well someone's going to do after surgery. It's really a blueprint. Taking care of yourself ahead of time is really the blueprint of how you're going to do once you're done, because you're going to have to continue to take care of yourself afterwards.
So I'm trying to figure out for a friend, for Hank, but if you had to give like a few pearls for like, I don't know, face washes or like skincare regimens or things that like you wish you knew way back when, or you wish you could tell everybody.
Or a
What
busy
would you
resident that wants to just make it easy,
Yeah.
like a thing that
Yeah.
Like
everyone shouldn't
yes,
skimp out on.
Yeah.
I
So
saw
I
on your
think
social media one day, I think you said something like, you wash your face. You have to wash
just
your
wash
face.
your face. Like
Yeah.
start with washing your face at night. That's it.
Hank,
Yeah,
Just
okay, let me
wash your
write that
face.
down.
Like get the
Okay.
day off, get all the crud off your face. Just wash your face at night. And if
with what?
anything,
With what?
everyone has their preference, right?
Okay.
I am biased. I prefer gel-based cleansers. I like ones that don't burn my eyes, because I used to be almost legally blind. I was like -8.5. So I like things where I can try to open my eyes so I could see if I'm wearing eye makeup, I wash it off. And so I try also to look for something that's not going to strip my skin or make me feel squeaky clean, because that's not good. You're going to then overcompensate. And so washing your face once a day at night is the way to start, because you want to get the day off. The second thing you must hopefully incorporate is a sunscreen in the morning, just like I have it literally next to my toothbrush.
That is so not Lebanese of you.
Trust me, this has been the bane of my existence my whole life. My sisters are much darker than me, and I burnt many times in my childhood trying to be darker, until finally I said, forget this. I'm going to embrace the paleness. But yeah, I wear sunscreen every morning.
365, no matter if it's winter or
Honestly, I'll
summer,
tell
right?
you, because not that you have to when the UV index is low, but I'd rather stick to the habit.
Of course, it's not
If I
gonna
quit
hurt.
the gym, I'm never gonna go back, right? So, and I've quit the gym many times and I haven't gone back for months now. I feel like you have to at least stay stuck in
Yeah.
the habit. If you find a sunscreen that doubles as a moisturizer, even better. And then understanding your skin type and the environment that you're in to find that moisturizer that mixes best with your skin. So like if you are oily in a humid environment, chances are you don't need a moisturizer, just use the sunscreen. But if you are dry in a very dry climate, you need probably a very thick, occlusive moisturizer. So understanding your skin type and your environment to really simplify it. And those 3 simple steps will take you very far. They really will. If you start young enough and you start understanding how to treat your skin young enough.
And one question just off of it, I don't know that much about this, but I would assume that different makeups and stuff like that could be really bad for your skin, or could maybe have some of those ingredients. Is that true?
I think it depends. If you're super oily, acne prone, and you're using, I'm making this up, right?
Yeah.
A makeup foundation that has a lot of like coconut oil in it. I'm making it up. I don't know
Yeah.
a foundation that has one. Of course, that's not going to be a good combination for your skin type. So I think understanding that there are different types of products and there are actives in makeup foundations. Like there's a foundation with niacinamide that I could think of off the top of my head. If you're sensitive to it, it's not going to sit well on your skin. So I think that's like step 15 of
Yeah.
understanding where
Let's
we're
first
at.
wash our face,
Let's just wash our face to
Yeah.
start with. But
Um,
yeah.
So another thing we were alluding to is kind of finding out our patients' expectations. And do they need a facelift? Do they need just to wash their face? There's two ends of the spectrum. So I'm curious, because this is something that also intersects with plastic surgery and dermatology, is all the different tools you have in your toolbox to fit what the patient, what you think they need, and what their expectations are. So whether it's skincare, injectables, lasers, or going all the way to surgery, How do you kind of navigate that process with each individual patient? And do you kind of view them as, complementary mix and mash, or are they kind of competing and wrestling with one another?
So we can keep the turf wars out of this discussion. Everything is honestly complementary. I'm
Yeah.
talking about skincare, injectables, energy devices, surgery. It is all a continuum, and they are not competing approaches. They're just different tools that address different aspects of aging. And I start off by telling patients you cannot treat your depression with an antibiotic. Just
Yeah.
doesn't work. So aging is a journey. Right. And if someone is going to choose to invest in how they age, and that's what they want to do, and it's a very personal decision, the most important thing from my viewpoint is to understand what to do and when, and also to explain that no single treatment is the answer to everything, which is a huge misconception that people think, I got a Fraxel, why do I still have,
Yeah.
laxities? So skincare improves like the quality of the skin. And I set this up from the very beginning. And I even go further in telling them that skincare can really make the biggest difference in the immediate future with your skin tone, because you're not going to get rid of your fine lines with skincare. Followed by that, we have injectables and devices that address different issues, certain structural and textural changes. But ultimately, do you want surgery in your life? And if the answer is yes, I ask them when. And if it's in like 5, 10 years, so I say, okay, we can play. But if it's in 2 months, I say, hold off, come back after 6 months. And that's a discussion that I always have. And I always let my patients know that I have a very short-term memory. So I bring this question up all the time, not because I think you need it or I'm pushing you towards surgery, but so I can plan for you accordingly without putting you down the path of like feeling resentful that you spent
Yeah.
now $5,000 on treatment to tighten, but you were planning to get a facelift in 6 months. Why would
Totally.
I ever do that? So
Yeah.
it's really about planning and sequencing and understanding where they are on their journey and really helping them make thoughtful decisions, looking at their timeline from a bird's eye view and not as a never ending road. Which, it
You,
sounds kind of morbid, but you want to kind of see
No, yeah,
when you're planning on doing things.
of course.
Yeah, it makes me also think to myself, like everything that you talked about and how these discussions sometimes overlap a little bit, or you have to kind of figure about the timeline, makes me think like, why are there not more centers where there are dermatologists and plastic surgeons all kind of working together in the same kind of private practice setting, you know? That seems to, but I know that there's a lot of plastic surgeons that we're friends with that have big cosmetic practices where they have estheticians and, but
Skin
it feels like
spas.
skin spas, but it would make a lot of sense to have like a dermatologist practice almost with plastic surgeons.
I agree with you. And I have my own private practice in New York City, and it's something that I've toyed with, in my own mind. The reason I have not done that for my office is because I've wanted to remain as free of bias as possible. Like, I did
Hmm.
not want to have anybody feeling that I am pushing somebody towards a specific surgeon
Hmm.
because it's such a personal decision. And if that person is in-house, of course, you're going to be pushing towards that, surgeon to get things
Yeah.
done because either you vetted them or you trust them, which, by the way, patients are looking for recommendations and names of people that you trust. So why wouldn't you have someone that you trust in-house? Like to have, unless I have like 3 plastic surgeons in-house doing, I don't know, I'm making this up, facelifts or breast augmentation. So I can have a choice of 3 that a patient can pick from. I think just having one limits the best options for the patient because
Yeah.
ultimately it is a relationship and you have to feel, you have to see how you feel with your plastic surgeon.
Do you find patients asking you for advice like, hey, I now want a facelift, like who should I go to? I'm sure they probably do.
I have a running referral list,
Yeah.
and I am shocked when people pay money to go to strangers to get advice on who to go to. And I ask, I'm like, why don't you just come to your dermatologist that you trust? And the answer is honestly, I understand now why these people's referral programs exist because they don't know if they even trust their own doctors.
Yeah.
So, or they don't have necessarily a doctor, or they just met, for example, me and they're asking me. And so I think there's a lot of confusion as to where to start. And not everybody has, built a long-term relationship with a provider that they trust and that they
Yeah.
want to grow with, or they haven't found that person yet. But I have a running list, and then I keep names of who referred which doctor, what that doctor was good for, nose, jawline, eyes, upper lids, hair. Like
No,
I
that's
have a
great.
whole list. Yeah.
Yeah. Okay, so now going back a little bit. So if somebody's preparing I know you've written about this or talked about this before in the past, but for the audience, if somebody is preparing for some sort of aesthetic plastic surgery procedure, facelift, neck lift, breasts, is there anything that specifically I just want to make this clear. Like anything that specifically you would recommend either doing or stop doing, or would you just continue the normal regimen?
I don't think you continue completely normally. I think if you're not someone who's super aware, oral health matters. So that's number one, first and foremost, before you go into even skincare. Minimize alcohol, avoid smoking, reduce all kind of systemic inflammation that you possibly can to the best of your ability. Number two, through skincare, I think you really want to focus on the stability of your like skin barrier health. If your skin is actively inflamed and you're breaking out with acne, I don't want you to go get a facelift next week. You know what I mean? So really making sure that your skin barrier is like intact, it's strong, it's healthy. And if you are someone who's very reactive, paring it back, minimizing how many actives you have in your skincare routine, not introducing new, harsher actives right before. Like I would not start a retinol 3 weeks before, hoping to help yourself. You should have been on it like 3 years or 3 months before. I also think if you're someone who's prone to hyperpigmentation, being on a skincare routine that is really stabilizing how you're producing pigment, that both has like pigment inhibitors, but also like inflammation stabilizers like colloidal oatmeal, but also kojic acid, arbutin, etc. You can test out the hydroquinone if you need to a few months before, but I would not jump in 2 weeks before if I don't know if you're going to be reactive to it. So I think you kind of have to play with that slowly. And then sun protection is of utmost importance if you want your scars to heal, without any traces left behind. I think all of that really come into play and help and make your outcomes better because you go into it calmer and you come into it with less potential risk of like inflammatory response, post-inflammatory erythema, post-inflammatory hyperpigmentation, etc.
Yeah, I think, and Hank probably knows this as well. I'm sure we had somebody come to lecture us about scarring, and that scarring really is like $1 billion industry, and there are all these things that are dedicated for scarring. And I know that I tell my patients certain things. I'm like, you have to use this product because I've just heard about it from like either my sisters or my mom. But what for like post-op care, scarring, like what do you think might help the most from all of your education, your background in science? What do you think might help the most, when to do it, and how frequently would you say to do it?
So I think number one, like you have to think of post-op care like in phases, right? So depending on where you are with your scar and the remodeling process and wound healing. So in the very, very early phase, which is probably like 1 to 2 weeks post, depending on your procedure, you really want to focus on wound healing and physical protection. So it's not seeing the light of day. And you're really focusing on minimizing anything that could disrupt your skin barrier health. Then once you enter that early remodeling phase, right, which usually is around 2 to 6 weeks post procedure, and your tensile strength is reaching 50 to 60% or whatever it is at like 6 weeks, you want to make sure that that's when maybe you start introducing like the silicone tapes or the silicone
Okay,
gel
good.
to
That's what I've
sort
been.
of, yeah, so to make sure that you're reducing any risk of hypertrophy, keloids, etc., because that will help. And during that time window, and this is more anecdotal from patient's experience, personal experiences. I've had multiple surgeries in my life due to health issues and stuff. Massaging scars can help, but you have to show how. Like gentle scar massage, not like you're rubbing the skin left and right. And of course, once
Yeah.
the
So
skin
show
clears,
us, how do you do it? Like,
like
how do you?
it's like literally if you take your thumb and you press down firmly but lightly and you just keep it in that same spot in like circular round motions,
Okay.
just like this. I'm not moving. I'm not going like this, right? I'm
Yeah.
literally pressing down, tap and go, tap and go. It really does help to minimize any contraction or thickening or firmness in a scar. And it's amazing how many people are scared to touch their scars. So that's something that I think when I see patients come in, they're like, why didn't the plastic surgeon tell me? I'm like, either they didn't like know because they're not learning this or they're not living it, right? Or they're worried that you're going to go too aggressive and potentially tear it. So patients often go wrong and strong. So it's multiple reasons as to why, but helping yourself in that process, and I walk them through it and I show them, makes a huge difference. And then obviously throughout this whole phase now, UV protection, whether it's through physical blocks like clothing with UPF or sunscreen. And
I
then
have to get better at
afterwards,
that.
it makes a huge difference. And then once you're in the longer remodeling phase, once you're like reaching that home stretch of that 80 to 90% tensile strength, you can really focus on the tone of the scar, starting with ingredients that minimize a little bit of post-inflammatory erythema so it doesn't become brown. Anything that contributes to the post-inflammatory hyperpigmentation, utilizing skincare products that are not even prescription, that can help yourself every single day while you're gently massaging your scars over the next like few months.
Any specifically, even like generically, that you would recommend?
For like ingredients or
Yeah.
what?
Yeah.
So I mean, I'm thinking of my own product, but this is not to plug, but like you can use Centella asiatica to help with the redness. You can use a little bit of arnica. I know arnica is often homeopathically formulated, which means there is nothing in the formula. So look for actual arnica formulations. I have arnica at a higher percent, for example, in my depuffer, and that's why I created it. You can also look for, and I know it's a little controversial, but you know what? Throw the kitchen sink at it. If they can help
Yeah.
themselves, why?
Totally.
What else can we use? We can even use a little bit of niacinamide, right? Not more than 5% because it becomes a little inflammatory after 5%. So that's for redness. And in terms of like pigment, you're talking about even gentle exfoliation, right? Every day, not something crazy like a 15% glycolic, but maybe a light mandelic acid. You're talking about, kojic acid and arbutin, which are the counterparts of hydroquinone, the precursors. And if you do it lightly every day, you're just helping. And if you've been using it prior, it continues the whole process. So those things make a huge difference. Like TMI, but I had a breast reduction. I have no scars. They have the scars, but you can't see them.
Oh my
You
gosh.
don't see anything because I was treating it with skincare and I was just like on top of it with the silicone sheets. And it was
Wow.
just,
Wow.
something that I now show my patients and I try to help them before I even laser them to see how much they can improve. And honestly, I
Did
don't
you
even
laser them
love
or just
no,
skincare?
I never did because I wanted to see how good my products were for my own scars. It was like
Yeah.
this little and I was like, "I'm never gonna be, like, topless on a photo shoot, so I don't care if
Yeah.
that's
Yeah.
I'll do it after."
Yeah.
But, I didn't. And what's amazing is I've also realized that with scars, I know oftentimes surgeons will say, "Start lasering it, like, at 6 weeks." I really do think when you first start with skincare and you work on the PIE and the PIH for the first 3 to 6 months, you get way better outcomes if you wait before you laser. And so I don't like lasering post-procedurally until really like 6 months. I want to see how the scar remodels on its own without triggering it and causing more inflammation while it's still in an active phase. So I tend to wait and I tend to put them first on products and like just wait and try this or, and I give the ingredients. I'm like, if you don't want to try mine, try other things. And we kind of put a little game plan for them. But they do get better outcomes when they wait a bit.
Yeah. Now for eyelids, the eyelid skin's a little bit more, it's a lot thinner, in some ways less forgiving. Is there anything specific for, periorbital aging that you recommend? Or I've seen on, you're probably going to shake your head at things online of like those rocks that people roll on their eyes, or those like stickers
The
that they'll
jade rollers.
24 or like 24 karat gold stickers they're putting underneath their eyes for
Yeah.
bags.
Yeah.
But what do you recommend?
I mean, I think the periorbital area is the trickiest, right? It's so thin, the skin, and there's hardly any oil glands. And so it's not as forgiving, and you tend to age fastest there, especially with hormonal fluctuations in women in their 40s and their lack of ability to hold on to hydration. So I think what I recommend is first and foremost, if you're like in your 15, teens, 20s, sun protection is critical. I know in the US we have crappy UV filters and they burn my eyes, but finding some kind of sunscreen that doesn't burn your eyes, whether it is even in the form of like an SPF powder to protect your eyes, or even sunglasses that have UVA, UVB protection. I think that is number one. Number two, it's how do you maintain the skin quality around your eyes? So utilizing a gentle retinoid, and this is where like an eye cream with a retinoid makes a difference. It's not just a BS eye cream that costs $500 to moisturize. It's actually making a difference. One that's formulated specifically for the eyes that your eyes can tolerate over time. Do you put it on your upper eyelid? Probably not. Just on your lower lid because you wouldn't tolerate it so much on the upper lid. And then really focusing on hydration and barrier support. And I think I found as I've entered my 40s, that finding thicker moisturizers and creams that really do hold on to hydration over time works better because it's not as hydrated on its own, right? So really things that have like ceramides for barrier support, glycerin for as a humectant, peptides even to help to promote collagen, all of that kind of helps. Last, I mean, one thing that I'm guilty of that I've messed up and I have a little bit of a ptosis in my right eye is not rubbing your eyes. I think I have really bad allergies and I used to rub my eyes like crazy and I wish I didn't, but also with contact lens use over time, you develop,
Yes.
so I have a ptosis on my right eyelid a bit. And I don't want to fix it yet until it gets worse so I don't look lopsided in the other direction. Really, if I could go back in time, it's other than the sunscreen or the sunglasses, is like just don't rub your eyes as aggressively as I used to rub them while I was studying.
Well, now you could
Yeah.
just rub the other eye a little bit more and then
I'm
bounce it in.
trying. I'm trying, but I stopped wearing contacts. I did LASIK, and I don't have that working for me anymore.
Yeah. You literally look like you're 18 tops. It's like crazy.
Thank you.
It's
I'm
No, it's so
42.
true. I know, and
Incredible.
I almost wonder, like, it would be funny if you could take you and take away your background in dermatology just to see what you would look like if you like, what your
I
skin would look like. Wouldn't that be
I will
so
tell
interesting?
you, I would look like a crypt keeper because I have melasma, and it woke up overnight after my son, and I
Really?
just did not recognize myself when I looked in the mirror. And it really, that's really when I lived that like mind, skin, face connection,
Mhm.
every single day. I would look terrible, I
Yeah.
think, if I
Well,
didn't know how to take care of myself.
I've learned so much. I'm gonna wash the crap out of my face tonight. And, like, my wife's gonna be like, "What are you doing, Saeed?" But this one of the most fascinating things I think is your outreach on social media. And I wanna go back, like, if you can go back in time to maybe the first sense where you said, "Okay, this is pretty cool, like, I actually have something that people are interested in." Like, can you think back to, like, the day or week where you said, okay, this is kind of interesting. Like, people are kind of digging what I'm saying. They're digging my advice. I should pursue this a little bit more.
I know the exact date and I know the year. It was like the week of July 13th, 2018.
Uh-huh.
Wow.
Because that's when I started on social. And I thought, crickets. Literally, I thought, who the hell's going to listen to me? And after a week, I would have said everything I wanted to say. And then we would be done because then you would have known everything, right? Turns out, joke's on me because 8 years later, I'm still going. And what shocked me the most is how much you have to repeat things in different ways to get the message across. And to really teach something is to teach it through different viewpoints. But I remember it very well. That's when I started on social, thinking, okay, it's going to really last a week. And to my surprise, it's still going.
Yeah. And I
Incredible.
think, like, thinking about that is, like, a lot of the things on social media, Hank and I have had these discussions before. It's like, when to engage trends versus when you push back and correct misinformation. And then you're writing kind of a fine line in politics, et cetera,
Oh,
especially when your name is out there, you have a product line, et cetera. So do you ever find the fact that now you have this product line, you have this name, and is it a fine line where you have to correct misinformation or engage in trends?
it is a fine line. One thing I've always never wanted from the get go was I've never bashed anyone, like in terms of hurting them or trying to come at them. But I got to be careful because I might post something tomorrow, which is just completely crazy. But I have to be careful about what I'm posting tomorrow. But genuinely, listen, I approach really trends through the lens of how can I educate responsibly? Because when you have a platform that reaches like millions of people, you can't just speak without thinking. And you have to be thoughtful about when you amplify something versus not, and when do you want to step in and clarify something. Because if a trend is harmless, right, it could be used as a gateway to teach somebody good skincare habits and to actually teach them about stuff for them to want to learn. And I'm so happy to engage with that. But sometimes trends and the language around certain things on social, especially as it becomes more fear-based, it's really something that I think we should not be scared of speaking up and, like helping to bring people together in a conversation versus then pulling them apart. So for me, I view if a trend is fear-based, if a trend is absolutely misleading, or if a trend is also potentially harmful, then I do think there is a responsibility to push back and explain it in a way that hopefully brings people in versus pushing people apart. And if you can give, the why behind skincare and explain that and really get people to understand that, then it becomes much more helpful for the viewers and the followers and people who are listening to you in understanding their skin for the better. And it's less confusing for them overall because now they know a little bit more, hopefully.
Yeah, Hank, I know you wanna ask about skincare market, but I wanna ask you one more thing because 'cause I'm thinking back to that's very important. That it's nice to hear about, like, your perspective on that, especially with social media and everybody kind of your followers watching, everybody watching and thinking about what you have to say. Um, and one thing that I want to ask before getting into the next section about your product line is thinking back to, again, my childhood, that, my mom was always talking about Sean Connery or like these much older men who just look really good with aging.
Huh.
And I think back to when I was younger, and it's always like these, like, and with my three, like, I have a lot of women in my life. Like, I have three sisters who I grew up with. whenever there was talk about men, it's almost like, the gray hair or the aged look was always very attractive. I wonder, is there like a trend now where you're seeing more men interested in caring for their skin and trying to appear youthful, less wrinkly, and things like that? Or do you think it's kind of always been this way?
I think men have always cared, but they've never voiced it as openly, for fear of retaliation by other men. But no, I think social has opened, the floodgates of information and allowed people to ask questions and allowed men to find other men who care about the same thing that they do, which creates little mini communities within that I think opens conversations and allows for things to be discussed more honestly and, in a much healthier fashion. I also found in my practice, like men are still hesitant to come in overall, but you're seeing more and more of them slowly but surely. And I think one example is, for example, hair transplants is a
Yes.
discussion that's coming up
Yeah.
a lot more often, where I'm being asked, much more frequently than I used to about that. And I think it's because of the social wave that's happening on social media, people getting them more regularly, et cetera, and talking about them. And it's raising awareness. And it's funny that it's hair transplants because I also think you can't generalize, but I'm going to generalize. And if men are listening, I'm sorry. Like, there's so many men who go, why do you get Botox and why do you want to look plastic? And I remember I have a family member who was debating me at a dinner table. And at
Wow.
the end, I just was like, you know what? Why did you get a hair transplant? And he went silent. And I
It's
think
true.
hair for men is the way that they can understand how a woman feels over decades, right, of aging. But men, it just kind of happens, they could treat it. But women are living with this constant thing of, kind of feeling, and yes, we can get into the patriarchy and all of that stuff. But it's something that I find resets, the conversation for men to have a better understanding of why cosmetics matters, to women the same way
True.
that hair transplants matter to men.
Yeah,
Yeah,
that's a
that's a
good
good point.
perspective.
Yeah. So I talked a lot about your origin story, starting social media and stuff, but I wanted to fast forward to today where you have this very successful skincare line. It's in Sephora on the shelves. Dr. Idris is what it's called. But I was curious what gaps you saw in skincare or what the impetus was for you to start your own line and then kind of just talk us through the process on how it came to being on the shelves at Sephora because, a lot of people can start a skincare line, but not a lot of people can say it's on the shelves at Sephora.
So again, being honest, I never anticipated having a skincare line. Again, it was not something that was in the orbit of thoughts or hopes or aspirations or desires, but it came about as I was growing on social, as I was educating more and more, as I was recognizing that people wanted a place to be seen and heard. I also was trying to figure out, what is this world of, why is everything just confusing? Then 2020 happened, and then there was even more interest in skincare. And with that came skincare drama that maybe a lot of plastic surgeons don't even know about if you're not into the skincare part of the internet. But there was a lot of skincare drama. Certain brands were completely misleading with claims of things that they were offering, and it came to light. One of those nights, I didn't know it then, but I had COVID and I had a fever of 102 and I
Wow.
didn't realize it, but I lost my mind on social. And I said, what is this? If we cannot trust skincare, who can we trust? So I was like, should we start our own brand? And I went to sleep. I passed out. And I woke up and the
Oh,
next morning there were 10,000 votes. 99% of the vote was yes, start a brand.
that's so
And
cool.
that made me realize that people not only wanted a place to be seen and heard, but they wanted a place to turn to that they could feel that they could trust. And I also then took a step back and started looking at all the skincare brands on the market. And again, no offense to the men, but they were all older men derms who have nothing in common with Shereene.
Yeah.
Sitting on the shelf. So that was like, okay, maybe there's something here. And that was sort of the white space. So then I thought, could I offer that's different if I'm not just trying to add noise in the marketplace? It coincided with my melasma. It coincided with the fact that I was trying to stick to this stupid 12-step skincare routine because I was trying to get all of these actives in at their best levels so I could make a difference for myself. And it was hard to adhere to because I had 2 kids under the age of 2. And
Mhm.
at the same time, I was trying to build out my practice. And so I was like, what if I could take all of these and put them into one product? It failed. And you don't want them all in one product anyway, because you don't want to exfoliate necessarily every day. And so that's how the Dr. Idris Major Fade line came into play, where we took those actives and we separated them in a way that makes sense. So you're getting the benefits of evening out your skin tone right? Through 3 different products that you can plug and play with other products if you must, but you'll get the best result if you use them together. It's literally how the brand was born. It took several months.
So cool.
Yeah, I just
Yeah,
started
amazing.
asking questions. Like, I have no shame in telling you when I don't know something. And I have no shame in asking people, like, teach me. And it was before AI. So there was no, bot to speak to. So I would just ask people, and people were at home and on Zoom. So they were more willing to take meetings. And that's how it started.
Yeah. That's really cool. And I'm sure like it must be hard sometimes, or not hard, but exciting too when you see your product on the shelf, just that perspective.
It's exciting and hard because when it looks dirty, I want to die inside and I want to clean the shelf. It's like your baby's sitting there with a soiled diaper on a shelf. And so it's very hard. And it's also, I don't know if any of you guys paint or anything, but like when you create something and you put it out in the world and it's then open to interpretation and critique and all of this, it's very painful when you know how much you've put into something.
I know.
It's a double-edged sword. It's
Yeah.
not
Yeah.
very exciting, but it could be very emotionally activating.
Yeah.
Of course. It's your
course.
brand, it's your business.
Yeah.
Like I can control my patient interactions, but I can't control how you washed your face. Did you
Yeah.
wash it on dry skin, or was your skin wet, or were
Yeah.
you using waterproof makeup? Like I can't control that.
Yeah.
So yeah.
Well, we just have a few more kind of more rapid fire questions.
Fun
And
ones.
this has been a lot of fun, and I've learned a lot. I'm excited about
Thank you.
this because, and I think the audience will be excited to hear about it as well. But what's one skincare ingredient, you kind of talked about this a little bit, you think you would never skip in somebody considering having facial surgery?
Probably sunscreen.
Sunscreen. Okay.
Yeah. I mean, it's going to sound so boring.
I'm going to buy sunscreen. I need to buy
Yeah.
sunscreen.
I feel bad. We just spoke about sunscreen and skincare. Like we didn't even get into my fat transfers that I'm so excited that I've been doing recently. Like
Let's
we're
talk
just-
about
okay,
it.
tell us
Let's
about your
talk
fan
about it.
transfers.
Yeah,
You
tell
have to
us
talk
about
about your
it.
fan transfers.
Tell us
No,
about
like I we like talked to much
Yeah, I want to
skincare.
hear about it.
And I'm like
Tell
talking
me.
to plastic surgeons. No, I just felt so I used to do lipo
Yeah.
years ago because derms are trained in lipo. Again,
I
no
didn't realize
turf wars.
that.
Aha. So let me
Yeah.
educate.
Yeah.
So
Okay.
So go back to the 70s, right? Let's learn some history in medicine.
Yeah.
So derms were trained in liposuction by Dr. Klein, the Klein method. And he brought liposuction to the US and brought it under to like local anesthesia, tumescent anesthesia, so you're not putting patients out. And historically, when liposuction is done under tumescent anesthesia, the risk of complication goes way down. There have been like 0 fat embolisms ever reported in history, right? So dermatologists started with liposuction, and then obviously, like everything, it gets diluted through different fields, which we all love and respect. But plastics took it over under general, etc. And I think over time, as things got diluted and as seen as more surgical procedures, the public views it more as like an OR procedure and not necessarily an outpatient procedure, and things get lost. And so I was very fortunate to have been trained in liposuction under tumescent technique, which I can understand why it's annoying because as a plastic surgeon, it's nice that the patient's asleep, there's less pain, and when a patient's awake, there's a lot of ooh, ah, ee, and you have to like hold their hand and stuff.
Yeah.
So there's different advantages to each, but I remember
That
this
must be
was like,
painful. Is that
it's
like
not.
manual
It's not. It's
aspiration?
very hard if you're doing, you can do it with a vacuum, but we're just doing it manually because right now I'm just taking like 200, 300 cc's for the fat transfers for the face. But it's not painful. It's just once you give them Valium, Percocet, laughing gas,
Yeah.
it's the tumescent that's a little bit uncomfortable and then they're fine.
It's a
Totally fine.
workout though for you to get all that fat.
Yeah.
It hasn't been that bad. For the little amount, my right arm is definitely much stronger, but it's not bad.
200 to 300 cc's is a good bit of fat to harvest though.
Yeah. But it's fun. So
Yeah.
we're having fun with it. So I remember thinking to myself, why is it that people are only getting these fat transfers when they're getting facelifts, when the clock is already too late and they're probably in their early 50s or late 40s and they've already started to decline hormonally, right? And biologically. And why don't we offer this, especially nano fat, earlier on without putting the patient through this surgery and having anesthesia and stuff? And so I've been like researching and thinking about it for like the past 5 years. And I finally implemented it in my practice last year when I had a little bit of break from Sephora and the skincare brand. So we've now have like full on protocols in the practice and we're doing literally 1 or 2 a day.
Wow.
It's really interesting. And it's fascinating because you learn so much with patients. And it's not about just putting fat for like micro fat for volume. It's about the nano fat and watching skin texture, acne scars, pigment, skin tone improve. Like I'm so psyched. I want to get one done this year for myself.
Well, who
So
will
is it
do it?
mainly
Are you going to go
periorbital?
to a plastic surgeon?
I'll get out and probably inject it. But I don't like, I mean, general anesthesia when I had my surgery, it really does take a mental toll. And I'm in awe of plastic surgeons and I have a lot of respect because how you guys meet patients without knowing them and operating on them and not knowing their
I
emotional
know.
outcomes is insanity in my mind. Because having lived it, I also know the emotional toll that anesthesia takes, right? Like, I really think that for every hour of anesthesia is a week of recovery. And so to be able to bypass that and go to work the next day and have your skin work for you over the course of 18 months is like, why have we not done this sooner as an outpatient basis, you know?
You're so right.
So I've been
Interesting.
doing it a lot more and it's been a really like it's reinvigorated my whole love for the whole field
What are
all
the
over
main
again.
regions that you're doing your fan fat transfers to?
Mostly face, right? So we're doing the face, we're picking up the under eyes, the temples along the zygomatic arch, but we've also done like hands. The most rewarding case was a patient who had a double mastectomy, breast cancer patient,
Hmm.
and it started the encapsulation of the
Yep.
what's it called? The implant started to show. And she did not want to go back through surgery because she's had like 4 or 5 last year. And on a whim, she was like, do you want to put some in here? Like when I was going to do her face, I was like, of course. We didn't care about her face by the end of the procedure. We were so excited by her chest. And she came back for her follow up and she was like, don't take a picture of my face. Take a picture of my chest. And she was like, can you record? So I have to do like a video. She asked me to record something so I could post it to educate. But breast cancer patients who don't want to go under, who are traumatized by surgery, it's amazing. And they're so happy. This is now my second patient that I've done for the mastectomy patients. Incredible.
Yeah. I can tell you though, I totally agree. The thought of, even for me, like I'm a surgeon, I trained for a while, I really enjoy it. The thought of surgery frightens me. It really does. It really
It's
does.
it's scary. Like, listen, every surgery I've had, and I've had myomectomies, I've had DNCs, I've had endometriosis surgery, I've had the reduction, every surgery, C-sections, not to mention I have 2 kids, has been terrifying. I try to psych myself up like, oh, I'll go to sleep and it'll be nice, and I'll wake up relaxed. But it's the after effect that's really terrible.
Yeah.
There's no way
Yeah.
around it. And I think patients need to be really evaluated, especially when it's like outpatient elective procedures for fun.
Yeah, and I think it's great. I think plastic surgeons are doing that as well in terms of trying to find, less hospital days,
Yeah,
shorter
that's great.
surgeries, what can be outpatient, what can be done in the office, and we're always trying to kind of push the envelope that way because overall it's better for the patient, the less they have to deal with all that extra stuff.
Yeah, I love that
Yeah.
for all of us.
One of the last questions that I wanted to ask was if you could give plastic surgeons one message from a dermatologist about anti-aging and skincare, what would it be?
It can't be sunscreen.
Yeah,
No, it won't be
besides this
sunscreen.
ingredient.
It
Yeah.
won't be sunscreen. It won't be. First of all, I mean, I think one message is that I think social media enhances animosity between fields, and that should really not be the case because it is all a continuum. And I think the best outcomes is when we all work together. But skin quality is just as important as the structure when it comes to aging. Because yes, the structure is going to change, and yes, there is going to be laxity, but the final results, and especially if you want those results to carry over time, and the ones that you see every day are going to be influenced by the tone, your texture, your pigmentation, your overall health of your skin. So when you have plastic surgery and dermatology, to Saeed's point, working together, patients will get the best outcome. And that way, dermatology will optimize your canvas and improve it for you to get a better, statue that you've carved at the end. But I think it definitely does lead to more natural, and you age better and more gracefully over time when they're aligned.
Yeah, I totally agree. I have to ask one last question, Hank, because I just thought of something. And one of my passions or my niche is radiation and radiation induced soft tissue damage. Because I do a lot of breast surgery and especially in patients who come in with radiation, I feel like those effects are so irreversible. Is there anything that you can think of off the top of your head with everything that you've done before? Because I've done fat transfers in patients who have radiated skin. It works okay, but it's not great.
How
Anything
much
that
are
you
you
have
putting?
suggest it depends on where, but a fair bit.
I think less is more, right? If you're able, and by the way, I do not harvest the fat and keep it because I'm terrified of like it getting contaminated and infection. So I do it on the spot, and that's why it's also nice to do it under local. But I think if you're doing it as a stepwise progression where you're introducing both microfat, but more importantly, I think in radiated skin, probably nanofat, while you're marrying that to like ablative devices, maybe fractionated CO2 even, I think it can restructure the skin from the inside out and the outside in. And I think having a framework where a patient understands that they're not going to be put under, but you're doing it like literally maybe every 3 months slowly in smaller increments. So you can watch like the amount of microfat that's taking versus not. And you could see the changes in the skin with the nanofat. And you do that for like the first 12 to 18 months, you know? I think patients will start to see the visible differences and they'll appreciate that they're not going under. And yes, it's probably more labor intensive because you're doing it, you know, slowly over time. But I do think you'll probably get better outcomes because if you're trying to shove all of this microfat in an area that has a poor blood supply, that's contracted, that's scarred down, that's full of like, what are you expecting? It's not gonna stick. It's not gonna even be 40% that sticks. Maybe you'll get 20% that sticks if you're lucky. And I just think if you're going very slowly and thoughtfully and allowing things to graft slowly over time, you're gonna get a better outcome.
Yeah. Well, thank you so much. I learned a lot. I love this. I'm glad that we were able to get this back on after rescheduling it.
No, likewise.
It was so nice to meet you. Thank you for joining us.
This was so fun. Guys, this was awesome. Well, thank you for having me. Thanks so much. If you guys are ever in New York, let me know.
Thank you for listening to The DIEP End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The DIEP End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.